I'm going to show you how to log on to the Ambition EDC, introduce you to the interface, and then show you how to screen, consent, and randomize a patient. So when you go to the website, you'll have your own individual website per site. You'll get to this landing page where you'll be asked to enter your username and password. You'll be given those before the start of the study. Click login, and then you'll be taken here to the home page. So I'm using this demonstration on the Ambition Haberone test server, and you'll see that you've got this interface here which allows you to go through screening, subjects, and also some other functions of the EDC. You can log out by clicking here. You can go back to this page by clicking on the home page, and you can also move through some of the other modules that are set up for our colleagues in the lab and in pharmacy. So for now, as I say, this EDC is for testing only. So any of the data that you see on this EDC is for patients that have been made up. So to screen a patient, you can simply click on the screening page. So you can click there, or you could have clicked at the top here, and you get through to your electronic screening log. So you'll see that I've been screening lots of different patients over the last couple of months, and this is where they're all stored. So patients have their own unique screening identifier attached to them whenever they're screened, and when they become eligible and are recruited into the study, they're then generated with a unique subject identifier. This way, by looking at this interface here, I can go directly to the dashboard of patients that have been randomized. I can move on to consent patients that I've screened and that are deemed to be eligible. And I can also review which of the patients I've screened which are not eligible. For example, this one here, I can see that this patient was ineligible because of a previous history of cryptococcal meningitis. So to start a new screening, you simply click on Add Subject Screening. And you get taken through to this page, which is essentially an electronic version of the inclusion and exclusion criteria. So you simply input your information for your patient. So I'm going to select a 20-year-old male, first episode of cryptococcal meningitis, known HIV positive, normal mental status, participant or the legal guardian willing to give informed consent, so this patient is. Is the patient pregnant? In this case it would be not applicable because it's a man. Similarly for breastfeeding, any previous adverse drug reactions, concomitant medication, and any previous treatment for cryptococcal meningitis. And then similarly, any other reason. So this may be something that's just deemed to be another factor that isn't captured in those questions, which makes the patient felt to be ineligible. Also here, I'm able to input the blood results. Now, these are the blood results that are the early withdrawal criteria for the study. You may have these blood results before you screen the patient, but sometimes they may not have come back before you've had the opportunity to do this. So if you have these results, please leave them in. Please enter them. And if you don't, then it's fine to proceed. You will not be forced to proceed with the answers to these results. And it says here they're ineligible if they meet specific criteria, which is essentially a very highly raised ALT and low neutrophils and platelets. So that patient, I'm going to click on Save. And then I'm invited to consent the patient because that patient was deemed eligible to participate in the study. I can actually go back into the screening log, and for example, I could change something and say that this patient doesn't have HIV. Highly unlikely in our study, but there we are. And then I'll be told that the patient is actually not eligible because their HIV status is unknown. So what I'll do is I'll go back and I'll change that to how it was before. And then I'll be invited again to consent the patient. This takes me through to the consent form.